any of you around when I have to meet my day. I don't want a long funeral. Tell them not to mention that I have a Nobel Peace Prize. That isn't important. I'd like somebody to mention that day that Martin Luther King Jr. tried to give his life serving others.
We are one of the longest running pipelines. We have served roughly 6,000 students annually in the North Quadrant of the Worcester Public Schools.
20 years for me is quite a milestone. When I was hired, I remember Deborah interviewing me and asking me, why do I think I can handle this job? And I said, I can take this on because I love working with children, I can help them focus, and more importantly, I see a vision of this really growing.
My name is Jonathan Kwong. I'm a second-year medical student, and I grew up right here in Worcester. North High has 3 academies, one of which is the Health Science Academy, and the students there focus on the health sciences. So I was in that academy, and through the AP Biology program, the pipeline program allowed us to come to the labs here and practice, what we learned in the classroom. Before that, I had no idea what I wanted to do at all for a career.
My name is Marian Young. I'm a first-year student here at UMass. I grew up part of my life in Ghana and then moved to Worcester with my family and have lived here ever since I was 10. I went to North High School. I took AP classes through the pipeline. So I took AP Bio, took chemistry, physics, and got the chance to do an internship and shadow clinicians and other health professionals at UMass in the pediatric department, which is great. Before having that internship experience and being part of the pipeline, I had a vague idea of what going to the medical field would look like. It really gave me, hands-on real experience into actually seeing what a day-to-day life looked like for a physician.
I couldn't be any more proud of them if they were my own blood kids. To see them walking around this institution is really very, very personally gratifying.
Asthma really affects a certain population more than others, so specifically children who are lower income and poor socioeconomic conditions. And through working with the primary care offices, the Worcester Public School system, and utilizing resources such as community health workers to do home visits, we have a much greater potential to improve upon their care.
Pediatric asthma, I think, to most pulmonologists is near and dear to our hearts. Given the fact that it is the #1 cause of school absenteeism and it is one of the major causes of ER visits and hospitalizations for children, I think all throughout your training as a pediatrician you see kids suffering from asthma and it causing, wreaking havoc in families and homes, and the fact that children are not making it to school and parents are missing work days, and it's very distressing to have to watch that on a regular basis.
I have a personal connection through my own family experience. My mom has severe asthma and I have a milder form of it. So I've spent a lot of my life trying to help her figure out how to manage her own symptoms, and that education provided me motivation to help others.
I think it's just terrific to be able to work with the school nurses and the families and realize that we're really making an impact on the children's lives, a really critical impact.
I want you to be able to say that day that I did try to feed the hungry. I want you to say that I tried to love and serve humanity. I just want to leave a committed life behind. If I can show somebody he's traveling wrong, then my living will not be in vain.